Good afternoon, and welcome to this UC Davis Betty Irene Moore School of Nursing informational webinar. Today, we are talking about the Residency in Education, Teaching, and Instruction in Nursing, also known as RETAIN, and the Nurse Faculty Residency portion of the RETAIN program. I'm Rebecca Bedeau. I'm Director for Strategic Communications at the School of Nursing, and I'll serve somewhat as your MC today. We want to thank you for taking time out of your busy schedules to join us to learn more about this incredible opportunity. For the next hour, we hope to highlight a bit more about the residency, why this traineeship program helps educate and train experienced RNs to become successful nurse faculty, and really what makes our RETAIN program unique. You will hear from our program leadership, faculty, and a current nurse faculty resident. If at any time you have questions for our panelists throughout the webinar, just post it in the Q&A. We will get to as many as we can. We have a designated time devoted to Q&A. We also have our RETAIN program staff members. They're online, and they'll be going through some of those questions, and you may even see a private message or a private answer if it's a very unique individual question that you might ask. Also, we are recording this, so we will share it with you via email in the next few days because we've got a lot of information to go over, and we want you to listen, but know that you can have some follow-up to kind of really cement it into your brain. So let's start. I am happy to introduce you to Dr. Deb Bakurjian. She is the Director for the RETAIN program. We'll go to the next slide, and welcome, Deb.
Thank you, Rebecca. I'm really happy to be here today to share with everyone a little bit more about the RETAIN Nurse Faculty Residency Program and what makes it so unique. Before we dive in, I'd like to introduce some of our panelists. So we've all met our MC, Rebecca Bedeau. And then I'm Deb Bakurjian. I'm the Associate Dean for Practice here at the School of Nursing. I'm a faculty member as well, a professor of clinical nursing. And as Rebecca said, I am the director of the RETAIN program. Not with us today, but you'll see her picture there, is Associate Director, Dr. Amy Nichols. She is with our nurse anesthesia program this morning or this afternoon, so she won't be here today. But then we do have Hien here, who has joined us, and thank you, Hien, ahead of time. Hien is one of our nurse faculty residents this year, and almost done with her residency program, getting close. All right, next slide. I'm going to share now what the RETAIN program is and give you an overview of our nurse faculty residency. Next slide, please. So as you can see here on this slide, RETAIN stands for Residency in Education, Teaching, and Instruction in Nursing. This is a grant that we received from the U.S. Department of Labor, and it's a part of a bigger grant, nursing expansion program with many, many states involved in that. I think there's 42 states involved in this grant. There are two tracks in it. The track that we're talking about is track 1, and this is the one that's really focused on nursing education. So our nurse faculty residents, we're talking today, we also have a clinical instructor internship program. You can see that in the bullets down below. So we received $6 million for this award. It's a 5-year award. And again, you can see our deliverables there. I'm going to say a little bit more about those in a minute. And our key partners, we have several schools of nursing in our greater regional area here in Northern California, and several different nursing organization partners that are very, very important to us. Next slide. So this really looks at our overall goals and objectives. We wanted to create a pipeline and education pathway for RN educators. There's lots of pathways out there to become an RN, but very, very few that actually take you on to become a faculty member or a clinical instructor. So that's what our focus is. And the goal is to increase the number of skilled RN faculty and clinical instructor in California nursing schools and programs throughout the state. with a focus on Northern California. Next slide, please. So by 2028, we hope to have 20 trainees complete the nurse faculty residency program. We have 3 NFRs who will complete their residency this year, and we have 8 incoming. So doubling the size of the program, more than doubling the size of the program. They will be starting in late September. And we hope to recruit some more trainees before applications close in July. One of the things that we're thinking about potentially doing is trying to expand this part of the program. The NFR program is a part-time commitment for approximately 12 months. 50% of the time is dedicated to completing a master's degree if you're actually thinking that that's going to do, being in a school program is part of what you would be doing. That there is tuition assistance. So if you are interested in the program, you're also starting a master's degree or will be at least a year in a master's degree, we can provide some tuition support for you. Otherwise, this is a traineeship. If you already have a master's degree, this is a paid traineeship. And so for that part of it, we offer a $75,000 traineeship amount stipend that you would get. It's paid out monthly. You can see the amount there. Our preceptors also get paid because they actually do a lot of work working with the nurse faculty resident, which I can attest to is a total joy. So it's a wonderful opportunity. If there are any of you who are listening who are thinking they would love to be a preceptor because you're already a faculty member, reach out to us and maybe we can see where we can work something out. And then there are some other benefits that if there are needs by the individual, they can apply for some additional funding for special needs. Next slide. So this program is we facilitate learner-centered teaching through creating our performance-based curriculum models and developing effective learning experience through instructional design programs. So these are all part of the learning. There are a set of competencies that are each of the NFRs have. It gets personalized to the experience that they're having across the 12 months time period. But it involves all of these these are some kind of examples of the competencies. Obviously, part of it is assessing and evaluating student learning, grading quizzes, grading exams, grading a paper, facilitating learner development and socialization. And some of this is really related to working with small groups and helping them to complete a project or complete an assignment. And then obviously functioning as a change agent leader by thinking about our current healthcare system, clinical practice and education, and what are the trends and standards that influence teaching and learning. So we try to talk about some of those things along the way as well. And again, making that personalized to the area that the faculty member is working in. And so one of the things that we really treasure a lot here in the School of Nursing is our continuous quality improvement. And so we really are working with our nurse faculty residents to get their feedback on the program, to make it, to give us areas that they think we can improve on. And so we've already had some input from them and made some adapting some of our roles and things that we're doing. We want to also impart that this is an important part of every educator, right? Looking at what you do, continually trying to improve your program. Understanding debriefing tools. We know that debriefing is often one of the places that we learn best. So how do you use those debriefing tools and apply them in the various types of settings where debriefings are worthwhile? And then functioning within the educational environment by examining, designing, and developing instructional strategies that innovate or using emerging technologies to promote motivation, performance, and learning.
Okay,
Okay.
Deb, I've watched you do many programs through the years, and you really have a knack for getting as much stuff in a time period to teach you whatever is on the learner end of this.
Absolutely. It's
Yeah.
absolutely, Rebecca. I'm glad that you mentioned that because it is a little jam-packed. And in navigating all of the requirements and the assignments, staying on top of the competencies, it's really a collaboration between the nurse faculty fellow as well as the instructor.
So walk us through the curriculum. What does a 12-month cycle look like so you can get all that robust learning fitted a meager 12 months?
Yeah. So the curriculum is consists of a couple of different major parts. One of the first ones is online courses that they take. There's the Health Professions Educator Graduate Academic Unit Certificate Program. It's a GOC, which is a lot easier to say than all of those words. And this consists of synchronous and asynchronous modules that each of the nurse faculty residents complete. It's a 4-unit course in the fall, in the winter, and in the spring. So it's a total of 12 units. They also have active learning where they have some synchronous modules, simulations, and clinical skills. And it will depend on which faculty that they're working on. If you come here and are working with a faculty member at UC Davis, we're on a quarter system. So every quarter, there would be potentially either a new faculty member or you may be working with a faculty member all the way through the year. So it depends on what the nurse faculty residence goals are and the availability of the faculty. So they're definitely precepting with the faculty. That means that they're working with them through their teaching in that course or in that program. And so this is really about making sure that the nurse faculty residents learn how to manage a course, what goes into the course design, making sure that they understand what a syllabus is and how to work with the syllabus, the types of assignments, working with a learning management system. And so there's a lot of those kinds of activities. And again, sort of tracking along with the competencies that the nurse faculty resident member gains. And there's also then one-on-one experience with that nurse faculty resident and the students. They may be tracking along with a particular group of students or having interactions with the entire class of students. So both the didactic education and then the precepting with faculty in the summertime where they've already completed the GOC. We're also working with the Health Impact to do the Benner Institute for teaching and learning. So those are also opportunities. This is an example. You can see what the program looks like. The 301, 302, and 303 are the GOC courses that I was talking about. They each have a teaching practicum. They each also have, along the way, there's wellness activities. The Western State Simulation Alliance, there's some trainings that go on around simulation, how to teach in a simulation environment, how to debrief in simulation. So those activities are going on. Depending on what program, there might be clinical skills that are also part of that process. And then in the fourth quarter, again, the teaching and learning program will be in there and working on quality improvement, making sure whatever competencies that have not been addressed in the first 3 quarters get addressed in that last quarter. So lots of activities, very busy the way faculty members are. I think it's always surprising when people see how much faculty actually do to prepare for a course and conduct that course, evaluate the students, all of the planning and that has to go into that.
Yes, I always laugh when people say, "Oh, you're only teaching 2 classes this quarter." Huh. There's so much more in the background. You know,
Absolutely.
yeah, you mentioned that you are working with 3 nurse faculty residents, this year, and because it is, your first cohort, there's a lot of learning that goes both ways. What are some of the things that you have learned from the residents, and what are some of the things that you may be changing as this, next cohort comes in?
Yeah, thank you for that, Rebecca. Well, I have to tell you, we've learned a lot from the this first cohort of residents. First of all, they know more than they think they know. And so it's been kind of fun to point out their skill set as they've been going along. They've given us a lot of feedback that we're taking to heart. And so some of the feedback has been around the gawk that, certain things that we could probably improve along with the gawk. Things that they didn't, they felt that they wanted to have more opportunities for actually teaching the students. So one of the things that we're trying to work on is how do we redesign so there's more opportunities for teaching. So those are two definite areas. And I think there's also some things around how we're managing the, we have this list of competencies. We're using with an Excel spreadsheet right now. We've been doing that. So we've changed that now to be able to use our residency management system. I think that's going to help us to really manage those competencies in a better way. So those are some of the things that we've gotten feedback on. I'm sure there will be more by the end, in which we will listen to, because it's been really important. As we told them, you're part of this program now, and the influence that you will have on the program and actually everybody that comes after will keep continuing to improve based on what the feedback is from our learners.
Deb, I think it's fair to remind people that the Betty Irene Moore School of Nursing is 15 years old. I mean, it's been 15 years since we brought in our first cohort, and we're looking at creating change agents in healthcare and being innovative in how we teach and prepare folks for what the real world is out there. So when you say you listen, I'm hearing that the students are really part of kind of that innovation, and they have a pulse on what is happening in real world practice because they come in as registered nurses and they've been students in the past.
Yeah, I think that's right, Rebecca. I think it's very important because we talk a lot now about the education practice gap, right? So it's really important for us to listen as educators, to listen to our students who are coming right out of practice and in this case are continuing. Many of them are continuing to work part-time, right? So the things that they give us guidance wise, feedback wise, is critically important for us to listen to it because we have to close that gap. We have to make sure that our students are practice ready when they get out of our program. And that doesn't mean that they don't still go into a residency program if there's one available for them out there, but there aren't enough of those programs available. So we really have a responsibility to try to make sure that we are current, that we are meeting the needs of the learners that are coming into our school. And our nurse faculty residents and actually our clinical instructor interns are really integral to helping us with identifying where those gaps are and giving us ideas about how we can improve that. There are certain things that we know and do well and impart, but it's part of what we have to always do is to listen to our learners.
Well, I want to hear from one of those nurse faculty residents who's probably shared their opinions over the last year. Hien Ho, as you mentioned off the top, is joining us today. Hien, thank you for being here. Can First off, how do you think the program supports career advancement for nurses who are interested in the academia side of things?
Yeah, thank you so much, Rebecca. Yeah, I'm happy to answer that question. So, in my participation in Retain, sorry, that's my Stanley. uh, Retain supports career advancements for nurses by providing the supportive instructional pathway that helps me transition as a bedside clinical nurse into the classroom facilitation aspect. In my experience, I've been connected with several nurse faculty mentors who've been pivotal for my development and learning as I've been learning how to become a faculty. And the support looks like um, a lot of what Dr. Bakurjian has mentioned, support through course presentation and curriculum development. They've taught me how to facilitate a welcoming, equitable learning environment for diverse student populations. And I think the best way that Retain prepares nurses who are interested in academia is giving us that in-depth look of career advancement and the responsibility of the nurse faculty outside of the classroom. So what are we doing when we're not in front of students, right?
Well, I can't believe it was September when you and I sat down. I think you had a few weeks under your belt and we talked about your hopes and dreams and why you chose this program. How has the program changed your perspective on becoming nurse faculty?
The Yeah, I can't believe I'm almost done with this program, but the program has definitely allowed me to become more confident in applying for and nursing faculty roles. And I didn't expect to feel as confident that I am now, but I have also been through a lot of valuable training and experiences that has prepared me for a faculty role. Um, once they accept me after this program.
Well, it hasn't all been smooth sailing, I'm sure. What were some of the challenges you faced and how did you kind of overcome them as you met them?
Yeah, as part of the inaugural cohort, me and my cohort mates have faced some technical challenges and programmatic challenges, working through the kinks of everything. But we've dealt with that through excellent teamwork. The retained staff has opened, um, well, been very welcoming to all of our feedback, and it feels like a collaborative effort that we're doing together. And the biggest challenge as a novice faculty for me, though, was overcoming that mental hurdle of being confident in public speaking and also trusting my clinical judgment, experience, and expertise to be able to disseminate it coherently, logically to my group of learners. But how we've overcome it is practice, practice, and practice. So the beauty of this program is that I'm not going through that practice and fumbling through it alone, and that I'm having a supportive faculty mentor with me by my side.
I've always thought it's interesting that you're a learner learning how to become a teacher, but that's exactly what it is. I don't know if it's an oxymoron like jumbo shrimp or something like that, but you mentioned the confidence building, which is so important, especially when you get up in front of a classroom or in a lab with students. You want to have that confidence. But what is maybe another valuable aspect that this program has brought you?
I have two most valuable aspects, and it's honestly the friendships we build along the way, right? And my professional connections that I've created throughout the program. And, one interesting aspect of that as I'm learning how to be a teacher, I'm actually finding that participating in the retain program has also enhanced my confidence at the bedside and changed my perspective in how I approach nursing tasks. So now I often find myself going, oh, I'm doing this. How can I frame this in a way that I can break it into chunks to deliver it in a teaching for future students? And how can I facilitate that learning so that the next generation of nurses can feel as confident as I do as an expert nurse at the bedside within their clinical setting?
I love to hear that not only future students, but current patients and families are learning and growing from what you're learning in this program. Okay, thank you for that. Do not go anywhere because there will probably be questions from those viewing today. Um,
Yeah.
Before we move to the question and answer portion, and thank you for those of you who have already submitted questions. I see them coming in. We will get to them. But Deb, can you come back? You mentioned earlier different partners, because obviously it takes a community to really bring the wealth of perspectives and experiences to these residents. Who are our partners and how are they involved?
And thank you so much for asking that question, Rebecca, because our partners are really, really important. Let's go on to the next slide. So here you see our current School of Nursing, Schools of Nursing and Nursing Program partners. On the left are 3 community colleges in our area: American River College, Sacramento City College, and Sierra College. And on the right, what you see are UCSF being a partner with us, as well as 4 of our California State universities: Sac State, Sonoma, Chico, and Cal Poly Humboldt. What I love about this partnership is that these are the colleges that have already committed that if you are a graduate of the Retain program, they will guarantee you at least an interview if they have a job opening. And that is a big deal. So some of the stuff that we help you with going through the program is to prepare for a job, get your resume or your curriculum vitae set up, and then we will connect you with a letter of introduction to any place that you want to apply. But here, if it's one of these colleges or universities, they are guaranteeing you an interview, which is a wonderful opportunity. Even if you don't get the job, you get the practice of having an interview to understand what goes into that. So let's look at our next slide. So we're also really, really excited to be able to share our nursing organizations that we're collaborating with. I'm sure we are going to add more as we go along. But right now we have the Capital City Black Nurses Association, the National Association of Hispanic Nurses, Sacramento, the Hmong Nurses Association, the Philippine Nurses Association, California, Capital City, or PNAC 3 as they're known by, the Asian American Pacific Islander Nurses Association, and Health Impact. I hope what you see up there is an incredibly diverse group of partners that we have. We are so proud to be working with them, and they are helping us as well by referring students to us and potential other partners. So we're delighted to be working with them closely. We're also working with the Kaiser Permanente Scholars Academy. Kaiser is very, very interested in this program, as they also are trying to develop faculty for the Kaiser system as well.
I also like to put a little plug into the fact that a lot of those nursing organizations, the Sacramento chapters, were founded by School of Nursing alumni. So
absolutely. In fact, most of them were.
I love it. We teach them to lead, and now they're leading and then coming and giving back to this program. Okay, so eligibility, how to apply. Can you walk us through what we need for an application?
Sure. All right, let's go to the next slide. So first of all, you have the valid and current active RN license here in California. You must possess a baccalaureate degree, not necessarily in nursing, but a health-related field, and then either working toward or have completed a master's degree in nursing, another health-related field. It could also be in administration or education. So the master's degree is, we originally thought that nobody could already have a master's degree. We asked for an exception. They granted that exception. And so we're delighted that we can have people come into the program even if they have a master's degree already. You must be able to participate in all of the learning activities, and this is a really important part, right? So you have to do all the coursework. You have to be able to be available when the teaching opportunities there, particularly the synchronous sessions. You have to be able to be on Zoom calls and work with your faculty mentor. All of that, and all of those are really important activities. So you have to be available for those. That means that sometimes you might have to make an adjustment in your work schedule. So that's something to be aware of. Also, all of the other things that you're required to have to be a nurse faculty member with a BLS certification, you have to pass a background check, fully immunized. Sometimes there's some special training needs, some special requirements if you're going out to a clinical site for any reason. So teaching in a pre-licensure nursing of any type, sometimes that means the faculty member has to go out to the hospital. You have to meet all of the requirements, even a clinical instructor, if you're going out to the hospital for any kind of reason. So this is about employment status. You cannot be working full-time. And that means either a 0.9 or a 1.0 FTE. So you cannot be working full-time, even if it's only 0.9, you're only working 3/12. You right now cannot be a current employee of UC Davis. We are looking also to get this changed. We're hoping we should hear soon about that. You can't be a current or former faculty member. So if you've already been hired as a faculty member anytime in your past, you're ineligible for this program. You can be unemployed or underemployed. So working part-time is fine. If you are not working at all, that's fine as well. People ask, can I work per diem? Yes, you can work per diem. If you are an incumbent, you can be employed by an employer who has an agreement with UC Davis School of Nursing to upskill employee to faculty or CIs. So, for example, if you're currently employed by one of our partners schools and you're doing something, not teaching, but something else in that school, we might be able to take you on then. So there could be some kind of a unique kind of situation that could arise where you're in what we would call an incumbent.
Once you get all the nitty gritty in, that's when these questions start coming in. So keep asking the questions. Let's talk about the applications and we'll get to them because I know people after that last slide have burning questions.
Okay. So, you know, our applications are open. You can scan the QR code. Everything is on the website. So you need to look at the website to see what you need. But right here, we summarize it. You need a cover letter. You need your CV or a resume. We need contact information for 2 references. So if you go on with the program, we will reach out to your references. And we need your transcript from your graduate program. Your applications are due on July 27th for the next cohort, which starts on September 16th. And we have rolling admissions for this program and also for our clinical instructor program. So if you're listening in on this one and you're also interested in the clinical instructor program, that's also rolling admissions. So scan the QR code, go to our website, and all the information is there for you.
Okay, thanks, Deb. Let's get to some of those questions.
Sure.
You talked about that you can't work full time. What does a weekly time commitment look like? Is it standard throughout or does it vary?
Yeah, it's going to vary a little bit because depending on who your faculty mentor is, who you get assigned to, whatever day they're teaching their courses, you'll have to be available, generally speaking, for that particular day. So there's that. There's also the graduate academic certificate. You have to be available for the day that most of that is asynchronous, but there are some synchronous sessions, so you have to be available for that. We also have some synchronous sessions for sort of the onboarding part of it, where we have you, it's an immersion activity where you come on, we onboard you. There's some simulation training that happens there. We often offer some simulation training midway through and kind of towards at the end. So there's some on-site activity for that. We have some ability to be flexible, so we will try to work around you. But if you are working part-time, it's really best that you talk to your employer to say, this program is going to require some flexibility in my scheduling, and can I get agreement that you will be flexible with us? So that's my best advice around that.
So incoming residents may not get a very regimented, strict calendar saying each quarter the in-person is at this time. It is going to have some ebb and flow depending on the mentorship.
Correct.
Okay. As a paid resident, are they considered employees of UC Davis Health?
Absolutely not. Because if we employed you, you would then be employed full-time, particularly if you were doing the whole thing with a master's degree, because that really is 100% time. So it can't be an employment situation. It must be a traineeship. This is a requirement of the Department of Labor for all of their programs. They are not an employer, they are a trainer. So it's a traineeship.
A couple of questions related to an MSN. The first one is, for those who are still completing their MSN, is it just tuition assistance available to them, or is the stipend only available to those with completed degrees?
A stipend is available for everybody, plus a tuition assistance. So the stipend is for you going through all of the work that we put you through to become the faculty member, the GOC course that you take, the working with the faculty member, the effort that you put into that. That's the $75,000 stipend. In addition to that, if you are going through a master's program, we can give you some tuition assistance up to $50,000.
If you're in Southern California and you're interested in this, is that a feasible thing? It sounds like it would maybe require some relocation, or a relative that really, really likes you to stay on their couch.
A good friend or a relative. You would have to be on site for any of the in-person activities. So for the fellowship itself, the immersion activities are 2 to 3 times, and they're a few days in a row. That's probably quite doable if you were in Southern California. However, if you get into our MEPIN program, or one of the programs where the teaching is in person, there could be quite a bit more time required on site. So it would just depend. And again, we would try to work around you. We would try to figure out a way to make it work. So I would say at least reach out and talk to us. Generally speaking, it's a lot easier if you're located in a general area within driving distance.
I want to bring in Hen too to get their perspective. Hen, you went through this. You went through some of what may have been crazy scheduling at time. How did it actually manifest for you? How did it work in a practical sense?
Yeah, I've been really lucky because a lot of my practicum hours, Dr. Bakurjian was my faculty mentor, and we did a lot of ours synchronously and asynchronously in a hybrid sense. So my contact time, I think in person on campus, I would say once or twice a quarter for me. But I know that some of my peers, they have weekly in-person schedules. So it definitely does vary and from NFR to NFR.
No, that's a good perspective. Thank you for having that. Deb, what type of teaching settings are residents placed in?
So you could be placed in a variety of different settings. So in our School of Nursing, we have multiple clinical programs, so you could be placed in any one of those. Our MEPIN program, Master's Entry Program in Nursing, is a pre-licensure nursing program. So that's an opportunity to be in a faculty position to go through that program. We also have a DNP F&P program. So you might be placed in the family nurse practitioner, even though you may not be a family nurse practitioner. There is coursework that is not clinical specific that you could do some teaching in. We also have a nurse faculty fellowship program, or not a nurse faculty, sorry, an advanced practice fellowship program. Hien did a lot of work with me in that program, in which we had curriculum around patient safety and quality improvement, which Hien has expertise in. So again, even though you're not an advanced practice provider, there are many aspects of teaching that work whether you are or aren't an advanced practice provider. If you are a nurse practitioner, it works exactly the same way. You may teach in some of the nurse practitioner programs. We would try to have those experiences, but there may be some fabulous experiences working within the MEPIN program as well, so that it's a different kind of classroom teaching to some extent. So any of those opportunities with our partners, again, it will depend on the courses that they're teaching. Obviously, the community colleges all have pre-licensure programs. Most of our Cal State universities also have pre-licensure and graduate nursing programs. So there's, the opportunities could be different there.
And as you mentioned, the program is still growing and you're identifying new opportunities. So there's something on the horizon that you may not even know of at this point, but it's possible.
It's true. It's absolutely possible.
Ken, I want to ask you a question that we have. How much, if at all, did you work outside of the residency program?
I currently work part-time. I do 2 12s on the weekends. And of course, when Deb mentioned, make sure to talk to your organization and program to make sure they're flexible. Thankfully, mine is super flexible. And I prioritize my weekdays for retain and my weekends for work. And that's been worked out really well for me.
I guess, yeah, you've got to be flexible and figure out what's going to work with your schedule and then kind of move along with it. Speaking of scheduling, Deb, you mentioned that the next cohort is coming in September. Then we'll have a 26-27 cohort. Will they come in the fall as well? Or are there ever any opportunities that a cohort may start in the spring?
Yeah, not in the spring, but in the summer. Our last final cohort will start in the summer. And the reason for that is that our grant ends in June of 2028. And we have to have everybody completed in the program by that time. So that last year, from 27 to 28, that cohort will start in the summertime.
Okay. So once people go through this, what certification or credentials do they earn? What do they have coming out that then gets them ready for that next phase?
So they're going to get a certificate from us, from UC Davis and our School of Nursing, that says that they completed this program. They will get a certificate that for some of the other coursework, the GOC, that also is a certificate gets produced. There's also a certificate that comes out of the Benner Institute Teaching and Learning. So there's all of those certificates. A letter from us talking that will describe the experiences that they had and the competencies. We also will pay for the NLN, National League for Nursing Education certificate. So there's some aspects of it that you have to make sure you meet all the criteria, but we will help pay for the prep courses. We will pay for the test for you to take that national certification. And of course, that is the gold standard, right, for an educator, is to have that national certification from the NLN. So the competencies that we develop are the competencies that come right out of there. So all of the things that we're teaching are related to those competencies. And then we also, again, as I said, will pay for a prep course for the NFRs to take that, go through the competency prep. And what we want them to do is to take that test and pass the national certification, because we get to count that as part of something that we accomplish in the grant. So we're very much in favor of that.
And Ken, how are you feeling about that next phase? You feel like you've been supported through the program and now you're being set up for success as you move into the final certification and then being able to teach?
Yeah, definitely. I've already started looking for faculty roles within the Sacramento region, and kind of nervous about sitting down for the exam, but I know I'll do well with all the practical experiences I've had.
I've always heard it's good to be somewhat nervous when you go into a test, because then you're not overconfident, but you're right at that level where you'll pay attention. So we can't wait to track the successes that you have along with your cohort mates. I will ask. Another question has come, Deb. This one is for you. What qualities make an applicant stand out?
I would say the number one thing is enthusiasm for and desire and focus on wanting to be an educator. It's not enough to say, yeah, I'd sort of like to dabble in this teaching thing and see if I want to do it. We don't want to spend $100,000 plus by the time all is said and done, right? For somebody to dabble. We want people that are committed to teaching, that can convince us that this is really the career path that they want. So that would be the number one thing that I think we pay the most attention to.
And Deb, everyone's probably read that there is a nursing shortage, but a lot of the reason there aren't nurses in clinical spaces is because there aren't enough nurse faculty to have all nursing schools maxed out to their capacity. So what power does a future nurse faculty hold in shaping the next generation of providers of care?
Well, I think faculty are, it's more than being a faculty member, is actually more than teaching a class or teaching 5 classes, right? It is more than that. It's modeling the role. It's having a perspective, leaning into wanting to help the students to develop into the nurse leader that they have, the potential that they have, and giving them the experiences that are going to make them successful as well. So I really think that faculty have an incredible opportunity to influence not only that individual student, but how that individual student goes on to influence others in their role once they start working as a nurse in a hospital or a clinic, wherever they are working. And I think the other aspect I would say about faculty members, in addition to teaching students in a course environment, there's a lot of mentoring. There's a lot of, oh, I just didn't do well on that exam and I'm so upset. Okay, well, let's talk about that, right? How do we help you to be successful? How do we help you to understand how to deal with failure on things? Maybe you're not going to pass every exam, or maybe you're not going to get the A you hoped you would get 100% of the time, right? How do we deal with that, and how do we learn from that? Because we're not perfect. All of us have had opportunities that we wished we had done better on, experiences. So we have to take that into stride. We have to figure out how we turn that disappointment into something that drives us for the next achievement. And I think our mentoring role that we have as faculty members really helps in that arena, and probably is one of the most fulfilling things that we do as a faculty member.
And I think that's a universal experience. I think we can all point to that, maybe that one teacher who had a profound impact on how we felt, decisions we made, possibly even the trajectory of our lives. So I can hear those threads. So what if we've sold our viewers on it today? They apply. What happens next? What is the process of the application process, and when they'll hear back?
Yeah, actually, you hear back pretty quickly. So go on, apply into the program. Clarice and her team will get back to you relatively quickly. There's a pretty simple online interview process. And then once we've got all of the documentation, again, we have to get all of those documents that we talked about. You have to give us 2 references, so we have to hear back from the references. We make the decisions relatively quickly because this is not one of the things like students or a faculty that's getting hired that has to go all the way up to the top of UC Davis to get approval for everything. We do it locally within our team, and we're quick. So you'll hear back within, a few weeks.
And I cannot stress enough how incredible your team is in preparing things, staying on top of things, making sure applicants have what they need, and then supporting the residents as they're moving through. It's quite a deep bench that you have assembled.
Well, I have to tell you, Rebecca, I have the best team in the world. And if it weren't for them, I wouldn't have the success I have, because they are just committed to the programs and they do such an exceptional job. So I agree with you.
Well, I think that's a great note to end it on. I do want to encourage our viewers today that if there were additional questions you didn't want to ask in the chat for whatever reason, please email this wonderful team, retain@ucdavis.edu. Of course, visit the website, learn more about the program and how you can apply. And then you can also register for updates. We do invite you to sign up for email notifications to receive news and updates about this program or other programs at the Betty Irene Moore School of Nursing at UC Davis. And as a reminder, we've been recording this, so we will get this to you in the next couple of days, and it will also live on the website sometime next week. If you have any colleagues or friends who may be interested and they weren't able to join us, we hope that you will share that with them as well. So thank you so much for taking time out to learning about our nurse faculty residency program. We will ask a favor. We want to make sure that these webinars are of value to you and provide good information. So if you wouldn't mind taking the survey, you'll find it on the screen when we close the webinar. And then you can also complete it when we send you a follow-up email, which will include the link. So thank you so much. Best of luck and have a great day.